call our meeting to order. It looks like it's 12:31. And would you just do the roll call of who's on?
Yes, we have Commissioner Brooks, Commissioner Waldruff, Board Member Bykowski-May, Board Member Liz Henry, Board Member Keenholz, and Board Member Rosette, and Board Member Syjon, and you.
Okay, great. Thank you so much. And we did receive some written comment. We're pretty much all virtual today. Is there anybody in the room to speak?
Yes, we have a Mr. Hancock.
Okay. If you would like to go ahead, take up to 3 minutes.
My name is John Hancock. I'm the president and founder of the West Plains Water Coalition and a member of the county's West Plains PFAS Task Force. I'm happy to say that the task force is in high gear now with whole house PFAS filters provided by $7 million from the legislature. And I'm grateful to Dr. Velasquez's leadership as the co-chair of the task force and the two navigators that he's hired to do the customer intake and the case management for a lot of my neighbors on the West Plains. And I'm just happy that that project is going ahead. There's a lot of work to do. The airport and ecology are still at loggerheads about the investigation. Yesterday's ecology update was pretty serious about the airport's behind the schedule and non-responsiveness to the correspondence there. And it's interesting that the ecology used the word public health emergency in yesterday's message. It's still an issue that I asked this board to consider. You've got the authority to make a public health emergency about PFAS, and I still think that that's what our neighbors on the West Plains need. Dr. Velasquez is also working hard with us on physician and clinician training for how to deal with blood test PFAS. For my neighbors who try to talk to their doctor about PFAS, sometimes they can get a test, but the clinicians don't know what to do with the results. So Spokane's kind of behind the other parts of the country with PFAS pollution about how medical care can advance in its understanding of the health risks of PFAS. Regarding the fires, there's concern now that there's lots of toxic runoff headed down the hill from structures on the north and west side. We don't know exactly how toxic that is, but it's headed downhill when the rain begins. So we hope that the health district gives some attention, not just to the big things that burned, but the toxic sludge that may be running down the hill. And I would encourage this group to take environmental health more seriously. When PFAS began, we understood that infectious disease was the specialty of this organization, but toxics in air and water and soil are just building up. And the more we know about the short and long-term health impacts of a toxic world that we live in, the more it seems like the duty that this organization has to protect us is more and more urgent. Thank you.
Hey, thank you so much, Mr. Hancock. Is there anybody else?
There's no one else signed up to speak.
Okay, well, thank you so much. With that, we'll go on to our next, which are board reports. For my chair report, just going to very quickly thank Dr. Velasquez for moving as quickly as he did and with a lot of thoughtfulness around the order to allow the EPA to clean up a lot of those sites where there has been cause for concern because of the fires. And so cleaning up all that toxicity, I think, is a really good thing. And also very grateful that there was a lot of foresight to build in some opt-out options for folks. I think that was very important to include as well. So I just want to say thank you. Myself and Commissioner Jordan were at the press conference when that was announced, and just glad that that is moving ahead speedily. So with that, we'll go on to our committee reports. Commissioner Brooks, Finance.
Yeah, we met, and so we looked at the vouchers and didn't see anything unusual that in the vouchers. And then we also are, with the approval of the Finance Committee, recommending action item 7B today. So those were some of the actions we took, and then we'll be looking closely as we start the budget process. I think the fees are going to be coming to us next, and then we'll get the budget underway.
Excellent. Very good. Thank you so much, Commissioner Brooks. Commissioner Waldron, I believe there was a policy meeting?
Yes, we had our Education and Policy Committee meeting, and we went through the last year's state legislative agenda that was adopted by the board, and we looked at, some improvements, changes, and discussed some of the top issues. Obviously, trying to fix the, long story short, there was a problem with funding some of the foundational public health dollars in the last biennium, and there was a mistake made, and funds that were supposed to go to public health throughout the state were redirected somewhere else. And so that issue needs to be addressed in the next biennium starting this next year. So we discussed that. We discussed some other priority issues. We discussed some other policy issues. So we'll have another meeting coming up here soon, and then we will bring some ideas in terms of a draft legislative agenda back to the full board for discussion and conversation, and hopefully adoption later this year. We didn't get into the federal legislative agenda. We just ran out of time. We also discussed that there was a new property tax mechanism that counties can consider, that is like additive on top of property levies for public health, as well as other behavioral health, veteran services. So we discussed that new option as well, and we can talk more about that and get more feedback at the next meeting.
Okay. All right. Well, thank you. Is there any questions for Commissioner Waldron? Not seeing any hands. Okay. Thank you, Commissioner. Patricia, I think you were on. I don't know if did we have a formal facilities meeting? I know we've discussed it a number of times.
We had the tour, so we toured the treatment services building.
That's right.
We discussed getting new carpet on the second floor. We went floor by floor, looked at exam rooms, patient artwork, file storage. And I enjoyed looking at the lactation serenity room. So we have a few things that are kind of in the works that need some repair, and let Travis talk about that when the time is right to do that. He has a plan for a formal path forward for capital projects, and we're just moving ahead.
Great. Thank you so much. Yeah, if you haven't had a chance to tour or check out treatment services, it's definitely worth taking a look at. So thank you, Patricia. That was a good tour. Okay, consent agenda. I'm going to look for a motion to adopt the consent agenda as presented.
So moved.
Okay, got a motion and a second. Is there any discussion on the consent agenda? I'm not seeing any. Okay, all in favor of adopting as presented, please say aye. Aye.
Aye.
Aye.
Aye.
Any opposed? Abstaining? Okay, that carries. Thank you so very much. And then I guess are we going into our executive session at this point?
Yes, that's my understanding.
Okay, so why don't we go ahead and do that? Michelle, can you read us in?
You betcha. So the board will be in executive session for 10 minutes unless extended and announced for the purpose of litigation, potential litigation pursuant to RCW 4231-10-1I. And in attendance will be the board members, legal counsel, and the administrator, Danny Scalise.
Okay, thank you so much. And do we have a breakaway room? Is that how we're doing this?
No, you are staying here in the room, and everyone in the room here at the district is being removed. And Michelle,
Okay.
I have the time starting as 12:41.
Thank you. So are we ready then, Anne?
Yes, and
Want to let me know when we are live?
Still waiting to go live. We are
Okay.
live.
Okay, well, welcome back. We completed our executive session in record time, probably 6.5 minutes. So thank you, Michelle. With that, we're going to jump into our action items. So the first one is 7A. Michelle or Danny, one of you going to tee this up?
I can.
Great.
We were visited recently by someone who pointed out a couple of errors in what we had to post. One of those is an index of public records. We believe it would be a bit of a hardship, much more than a hardship, to be able to keep that index up to date. And it is within your purview to exempt that. I believe the city did so a number of years ago, and other bodies here locally have done so also. We're asking that you pass the resolution that's in your packet, which will exempt us from posting and keeping that up to date in a public area. We will still have all that information available for public records requests, but it just won't be posted sitting out in front of the building.
Does anybody have a question for Danny on this, or unclear what it is that we're doing?
Can you put the resolution on the screen?
Just a moment, I'll bring it up.
While she is doing that, I'll just comment that this was an action that we also took at the Spokane Transit Board just a couple of months ago, and for similar reasons, the hardship of maintaining the index. And I was not entirely certain or sold, I guess, at first. We deferred it for a couple of months just to get some more information and think it through. And ultimately, we did decide to move forward with that because it is a hardship, and it doesn't in any way prevent or impact anybody's ability to get records fulfilled. So that was the decision of the transit board. Okay, it looks like we've got the resolution up. Patricia, did you have any comment or question related, or did you just want to have that on the screen?
I just wanted to look at it. Thank you.
Great. Okay, well, looking for any other questions, comments, or a motion to move forward and adopt this action item.
I would move to approve the resolution.
Okay.
Blakowski, may I?
I would second Commissioner Brooks.
All right, thank you both. We have a motion and a second. Is there any further discussion? Seeing none, all in favor of adopting resolution 26-12, please say aye. Aye.
Aye.
Aye.
Any opposed, abstaining? Okay, that carries. And then our second item is approval of roof repairs. And I don't know, is Travis there to make any comment, or Danny, do you have anything to add?
Travis is here. He can give you an update on where we are. Go ahead,
Great,
Travis.
thank you. And we did talk about exec meeting and budget meeting last week.
Good afternoon, everyone. If you remember last Board of Health meeting last month, we talked about a similar project that we had put out to bid, and our bids came back significantly higher than expected. I have much better news this month. We've gone back out to bid with an adjusted scope of work that would refurbish our existing roof. Our targeted dollar amount for this project was about $300,000 for what we're calling the base bid, which is it's the general area of the roof of our building, subtracting the turret roofs. Our low bid came in at about 275,000, which is even better than we were anticipating. So my recommendation is that we move forward with that base bid. In addition to that, we got alternate bids for removal of some derelict equipment that's currently on those turret roofs. These are old cooling towers from an old HVAC system that we had years ago. By removing those, we would be eliminating penetrations through that roof, which is ultimately going to keep our roof healthy for longer. The less penetrations that we start with, the less places that we have for water to leak in the future. And then another alternate that we have presented is for the restoration of those turret roofs. So same scope of work, just extended into the turret roofs after that equipment is removed. So what we're looking at total, including tax, is $462,000 or thereabouts. SRHD's contribution to that is going to be about $308,000. This is anticipating, I think it's about $115,000 left over in ARP funds. So our initial project that we had discussed just for the base, so not including any work on the turrets, we were anticipating that at about $550,000, while bids came in at $835,000. So ultimately, we're completing a larger scope of work. We're doing some value-added projects for the building. And if we move forward with the full package, even though we're spending less than we originally anticipated, we're still in a situation where we don't expect to even have to discuss roof projects for another 15 years. So overall, I think this project represents a great value for the district, and it far exceeds what we had originally set out to do. So any questions on this project?
Anything for Travis?
Just for my notes, Travis, what was the third one? The second one was removing the cooling towers, and what was the third thing that you mentioned?
Yeah, it's the same scope of work, but it's applied to the turret roofs where those cooling towers currently sit. So the base bid is our, it's the roof over most of the building, not including the turrets, and then what we're calling alternate one is the addition of those turret roofs.
Okay, so can I make a motion to approve the whole package?
Please. Is that your
Second.
motion, Patricia?
That's my motion, yeah.
Okay, very good. Thank you. All right, we've got a motion and we've got a second. Who seconded?
Dr. Blackowski may.
Perfect. All right, is there any further discussion? Seeing none, all in favor of adopting the motion, please say aye. Aye.
Aye.
Aye.
Aye.
Any opposed, abstaining? All right. Thank you all so very much. Be nice to get this thing going. With that, we are into our reports. Danny, do you have anything for the board, or is it all written format?
No, everything you need for the reports is in your packet.
All right. And finance as well, or do we have a presentation?
Finance as well.
Okay. And then Dr. V, I do see, or I saw that you had some slides. Is that right?
Thank you. Yeah, my report is in the packet as a presentation for you. I just have one comment that is not in the report, which is an update on the cleanup from Region 10 of the EPA. As of Tuesday evening, they had completed 267 of the homes. That's about 1/3. That's in a week's time. So we will keep updating the community as we get additional information. Thank you.
It's incredible how quickly they're working. All right. Is there any questions then for any of those three items, or administrative officer, budget, finance, or the health report?
So this is Dr. Blackowski may. I don't know if this is the appropriate time, but just going back to Mr. Hancock's earlier presentation about potentially designating the PFAS issue as a public health urgency or emergency. I don't know if this is the right place with the health officer to opine on making that resolution, or if it's separate for board member kind of update on whether to pursue that.
I think it'd be completely up to the health officer, but do you have any comments, Dr. V?
Sure, I have a quick comment. I think the caveat has been that this is a statewide issue. It's not just a local issue, and that's why we have not declared a public health emergency. That's issue number one. Issue number two, even if we declare a public health emergency, there will not be additional funding allocated for PFAS to Eastern Washington. So because of that, we have focused the efforts on the PFAS task force that does have some funding for mitigation, and that keeps moving forward. I think Mr. Hancock's question has to do more with increasing awareness to the community, that those community members that may not be fully aware of PFAS, and that's also being addressed through the PFAS task force, as well as other efforts in terms of community outreach, which is part of what the navigators are doing by going door to door to make sure that people do know about PFAS. So that's why it has not been put on the table at this point in time, although it has been considered. And I did have a conversation with the Secretary of Health also, and they're not at this point in the disposition of declaring a public health emergency at the state level either. But certainly we will continue following up this issue. Thank you.
Thank you, Dr. V. Just question for you on that. Recognizing we don't have any additional powers or monies to unlock through a health emergency declaration, should the state go down that path? Are there dollars that they have put away for such a situation?
They have not identified funds to that effect at this point in time. I know there will be a legislative and governor's budget request coming forward for the next session.
Gotcha. Commissioner Brooks?
Yes, and just so people know that the navigators that have been hired by Spokane Regional Health District were actually funded by Spokane County, if I'm not mistaken, just so that people understand that was trying to keep it independent of the county, and so that's why we provided the funding for then the health district to hire the navigators.
No, thank you for that.
Good point.
Is there anything else from anybody? Just go to the order or follow up on this. Commissioner?
I have, for the good of the order, basically looking at next month's health board meeting. It does fall on the same date as the State of the County address, which will be with GSI. It's a luncheon that usually lasts until 1 o'clock. So I will probably not be attending the meeting, but several of all the commissioners will be attending the luncheon. So I think in the past we've delayed the start of the health district meeting. So I just wanted to put that out there.
Yeah, Commissioner, we talked about that at the exec meeting last week, and I know we agreed to push it back. Is it a 1:30 start, Ann? Is that what we agreed to?
That's correct. It's a 1:30 start.
I think we said 1:30, yeah.
Okay. So yeah, it'll be a 1:30 start, and I think half or more of the board will be at that, and so for sure we had to move that. Thank you for raising that, and reminding me and us to make sure folks knew that there is a change of time. So yes, at our September meeting, which is on September 24th, we do not start until 1:30 for the public who may be paying attention to this meeting. Is there anything else from anybody around the board? If not, then we will adjourn this meeting, and we'll see everybody on September 24th. Thanks all.